Hello and welcome to another edition of Hypnosis Helps with me, Neil Myers, hypnosis practitioner, and my colleague Bill Miller, fellow hypnosis practitioner. Welcome back. And on the last show we spoke about hypnosis in relation to physical phenomena. Hypnosis is, if it's thought about at all, is often thought of in terms of its effects psychologically, mentally, emotionally. Increasingly these days, people seem to forget that it has effects physically as well. These effects and phenomena of hypnosis were of great interest to people that investigated hypnosis in ages past, ranging from the earliest serious investigations of hypnosis in the middle of the 1800s, right through up until very recently, even in some very recent studies. Mm-hmm. So people have been intrigued by and fascinated by hypnosis and its effects upon the physical body. We're going to continue that theme a little bit today because there's more to see. Just to set the background a little bit and to understand in overall terms why this can even be the case, I just want to talk about something which just struck me. You know, we speak all the time about how I read a website, I was reading a website, Bill, where it was talking about how studies have been shown that hypnosis can produce blistering on the body. And by the way, so the blistering is produced where people are brought into hypnotic state, and a cold coin, not very cold, just a little colder than room temperature, right, put on a part of their body, but they're told it's hot, and that part of the body blisters. And these studies have been done at various times from about the 1890s all the way through. I think the last one was done sometime in the 80s, similar types of things. And this is quite a well-known phenomena. And then it gets reported. And what happens is these websites go, well, you know, I don't know about this seems like very skeptical, this seems like a magic trick, and they go on and on and on like this. And one of the things that struck me was that the very crude belief implicit in the so-called skeptics is the idea that the body and mind have no connection whatsoever, that the only thing that can affect the body is purely chemicals or heat or cold or electricity or anything like that. Mm-hmm. And yet, as I'm sure you know out there, doctors have been saying, and others have been saying for a long, long period of time, that many, many illnesses are manifest as a result of, as they put it, stresses or anxieties or other things. So it's well known, and it's not denied, even in the most conventional Western medical circles, that there is a connection between body and mind. Right. And so I personally find that type of blanket skepticism, the kind of, well, I don't know whether that can really happen, really rather foolish.
You know, the other thing about it too is I think even if they understand there's a strong mind-body connection, mm-hmm, and they understand that things like stressors can make diseases worse and things like, mm-hmm, this. I think one of the basic things that's not understood is they think that this subconscious part of our mind that's doing this is uncontrollable, yes, that we can't control it in any way. Right. And so it just happens to us unless we take a deep breath when we're stressed or something like that. Yes. And the whole thing we find in hypnosis, and it is remarkable, is how many things can actually be under our control through the hypnosis process. Right. You know, I mean, so a lot of things can be. And I know years ago, I was at the time was having panic attacks and my heart rate would go up. And I sat there and my heart rate was going through the roof right before I was about to speak publicly, and I realized what was going on in my head, what the thoughts were. And I said, let me cut those thoughts out. And all of a sudden, my heart rate went from pounding right back down. Mm. Now that was a conscious thing, yeah, because I realized consciously what was driving the stress around that. So I changed it consciously. It's the same thing with the subconscious.
That's very true. Yeah,
you know, I mean, so it's and there's just a lot of examples of it, and it's too bad that it's not more widely known.
Yes, and so and I think one of the in ages past they were extremely interested in examining these phenomena to try and determine what the limits of these phenomena were, and interest in that has lessened significantly, mm-hmm, since those periods of time. And today we've talked about, and we will talk about in other times, hypnosis used for anaesthesia. And I was getting my hair cut, whatever's left of it, at my barber's this morning, and he was commenting on the fact that his girlfriend had a tattoo on her ankle, and usually people who have tattoos there, it can be quite a painful area to have a tattoo in.
Right.
And he was completely shocked by the possibility of hypnoanesthesia.
Right.
It was a complete shock to him. He didn't
Right.
really know how, and so a little quick search on the internet just to point out that I'm not the only crazy person talking about this type of stuff,
Right.
that there's other things out there.
Right.
And it was there. And so we want to explore this a little bit more today. And you've been doing some research and have revealed some very, very interesting things. So, you know, I'd like to pick this up. But just before you do, just to set the background of it a little bit, we have a belief that, not just a belief, but our model is that there is this, I prefer to call it an intelligence. Some people will call it an animating spirit or whatever, but something that controls this thing that we call a body, which really is, what is it? It's a series of liquids and water and chemicals. Without that conscious and subconscious mind, there is no life. And so if we take the view that all our functions are governed by this subconscious intelligence, including our heart rate, our digestion, our blood flow, our organ function, our lymph function, our nervous system, through the actions of the brain, which in itself is part of the body and under the influence of the subconscious mind, then it's not such a big theoretical leap to say, well, if that's controlling it, then, and if we can get access to that, and as you say, some way find a way to control it, alter it, change it, manipulate it in some shape or form,
Right.
then at least theoretically, there's no reason why we shouldn't be able to affect certain body phenomena, and this we found. So
Right.
that's the theoretical basis and background.
Right.
So as you view this out there, rather than view it as a series of strange phenomena, I prefer if you try to view it in the context of that particular model of the mind and the body acting as a cohesive unit.
And the thing is that, you know, and of course, you know, I came from a scientific background, chemistry, biology. I developed drugs for 36 years nearly. And I'm always a believe it by, you know, by experiment and
Right.
so forth. And I always want to understand why something could happen, right?
Yes.
In the case of the burn we talked about with Dr. Dabney Ewan is when you first told me, oh yeah, well, he's reduced the burns, you know, with these severe burn cases in a burn unit, he's reduced the burn, and I thought, nah, it can't happen. Well, then when he explained it in his book, and it said, yeah, there's the initial physical burn, and then the body reacts to it and sends in these agents that actually makes the burn worse.
Mm-hmm.
You know, it's trying to heal it, but it's doing the wrong thing.
Right.
And so by suggestion, he could stop that secondary burn.
Right.
And so now that makes sense.
Yes.
Okay, so there's definitely an explanation to it. And I think you find that in a lot of these things, there is an explanation if we could find it.
That's true, and this is Bill highlights a very important point. We don't always know why what we do works. Now, that doesn't mean that we shouldn't spend intelligent effort on trying to find out why what we do works, because the more we know about why what we do works, then the more effective we can be. And we're always, in our practice at least, attempting to explore the envelope, the limits of where we can be effective.
Right.
Because if we understand those limits, we can understand where to focus our time and energy and be more effective. So it's not that we don't want to understand how things work, but sometimes if we follow a set of protocols and procedures, things just have an effect and they work. We can't necessarily say that we know exactly why, but we can say that those effects are useful and valuable to our clients and to others like you right here and now who are listening to and watching us speak about this information.
And just to put a point on that, the fact is that, you know, somebody out there might say, well, they can't prove it, you know, this and that. Well, that's not unusual. You know, I worked in the pharmaceutical industry, and the fact is that a lot of times we would know what a mechanism, what the drug would affect as far as mechanisms in the body.
Right.
It affects the passage of calcium across the cell membrane or something like that. Did we know exactly, well, why did that change X, Y, Z? The answer is no. You know, but in the end, what you do is you say, I do X, and Y happens. And that's the whole idea of proving medications work. You just have to prove, hey, when I give it to these subjects, this condition gets better or gets alleviated or cured or whatever. And as long as it's consistent and it's done with scientific rigor, that's the proof you need to put a drug on the market. It's no different here.
Yes.
We do X with the subconscious mind and the conscious mind, and Y happens consistently.
I read something fascinating in connection with this. So many of you will know that the reason the first modern hypnotist was Anton Mesmer. And Mesmer was probably the most famous hypnotist ever. Literally tens of thousands of people would come for cures. And he cured by this process that he described as animal magnetism. Now, sometime later, his methodology and his approach was, I suppose, debunked.
Discredited, right?
Discredited.
Because he really thought it was magnetic forces.
Magnetic forces.
Yes.
And one of the people that was on the debunking committee was a visiting American called Benjamin Franklin. So later on we discovered that Franklin made the observation that it was the people were suggesting to themselves healing and therefore were healed, which was a very insightful observation. But one of the most interesting things that's occurred recently is Mesmer would do these passes, passing the hand down. And we know that mesmeric passes combined with breathing was how Esdale produced these very, very deep states of hypnosis, sometimes called hypnocoma, now sometimes called the Esdale state, where he was able to operate on people painlessly. But here's the interesting thing. A recent study was looking at the sort of very, very fine electrical impulses that come from a human body, from one body to the next, which we couldn't really measure up until relatively recently.
Right.
And so, in a strange way, Mesmer might have been onto something. He couldn't understand it in terms of what he did, and it wasn't magnetism in the sense that we think about it now.
Right.
But there does appear to be, even by physical measurement, something occurring between, two human beings in proximity. Now, people are still researching it. We don't know, but it's just curious to see. He practiced something, observed a phenomena, as did Esdale.
Right.
Produced a state, but we don't always know why.
Right, exactly. So let's move into some of the actual physical things that we didn't talk about last week.
Right.
I'll just start by saying though that one of the things we ended on was fertility and a case study done by doctors, okay, with their patients who were having extreme difficulty getting pregnant, and what they did
with no physical pathology.
Right, with no physical causes and so forth. And they took 20 cases and they divided them into two groups. And, one got hypnosis and one did just normal life. And what they found is that 2 out of the 10 cases where they didn't use hypnosis, after a year, within the year, the woman would get pregnant. In the other one, 8 out of 10 got pregnant in hypnosis groups. Now, it's not a huge group, and to do statistically significant and valid research that way, to absolutely prove it, you need larger sample sizes. But honestly, when you see 2 out of 10 get pregnant in no hypnosis and 8 out of 10 in hypnosis, that's pretty startling.
Yes.
And so and then he even went on to figure out why some of the 2 out of 10 didn't.
Yes, that was really interesting.
Didn't go. So anyway, so let's talk. Let's move on from the fertility thing, and talk about things that are in the same kind of area or whatever. So you've got some women have what's called dysmenorrhea. So that it's extremely painful periods, and it could be heavy blood flow and so forth. The doctors that Dave Ellman taught back in the 40s, 50s, and 60s, he taught them how they could help these women with these extremely painful periods and heavy periods. And first, what they said is rule out serious causes, organic causes, and we always ask that of our clients and make sure they've been to a doctor and all checked out, because we don't want something, cancer's forming someplace and causing the issue and it's not found. So we always check for that.
And so again, just to interrupt this, so again, if you're visiting a hypnosis practitioner or contemplating visiting one for any reason at all, and you're dealing with a serious issue, we definitely recommend that you've explored all the physical options fully first. As fully as reasonably possible. You've taken opinions, taken second opinions. It's very, very, very important. And the more serious the condition that you're dealing with, and people come to us with some very serious conditions, the more important that that's the case. After this show, I'm about to go and work with somebody, and quite simply, his condition is such that doctors really don't know what's wrong, but they cannot explain what's happening to him at all.
Right.
So he's reached the end of that. But what Bill says is so important. And so if you're contemplating seeing a hypnosis practitioner, please ensure that they and you are qualifying and asking questions in that way. And I would say particularly anything to do with the head or the brain, even things as common as migraines.
Right.
Just make sure.
Right.
Because we never want to be mistreating. We want to be following that Hippocratic primary directive of first doing no harm.
Right.
So I'm sorry to interrupt you.
No, that's okay. So he had, he taught them how to help these women, and what it is he just used direct suggestion. So put them in a very deep hypnotic state and gave them suggestions that their periods would be more comfortable and things like this, and also about the flow would be normal flow, and it's not heavy and so forth. What he did find is that sometimes you may need to repeat this every month for it to stick in there. Shortly before
their period.
Yeah, a little bit before their period. And you can teach somebody to do self-hypnosis, and they can do it themselves if that's the case. But if he finds that it doesn't stick month after month after month, or if it fails completely, then what he found is that the woman's subconscious mind may actually be holding on to an idea that it has, and so is holding on to the dysmenorrhea for a very deep cause.
Right.
Okay, and so direct suggestion, subconscious will go, no, I'm not doing that.
Right.
Okay, and what he found is at that point, if you did regression, which you bring the subject back, the woman back to an earlier time where a trauma occurred or something like this, and you change that, reveal the cause and so forth, then sometimes it just goes away completely.
So this again, and those of you that have watched our show and watched our other videos will know that this follows along the lines of things that we've talked about many times. When Bill's talking about direct suggestion, we mean bringing someone into a hypnotic state and giving them suggestions constructed in a particular way in that state. Now, most hypnosis deals with that almost exclusively. And sometimes it can be effective.
Right.
Sometimes, as in the case of these ladies with dysmenorrhea, it was just a question of repeating that, so it kind of stuck. But, and this is the big thing that we talk about again and again, where direct suggestion hypnosis is ineffective or proves to be rejected, or even sometimes the symptomology worsens.
Gets worse, right?
It does not mean, folks, that hypnosis doesn't work. I'm often told by clients, it's not working. And the subconscious mind is working. We just don't understand how it's working.
Right.
And in this instance, what Bill is saying is that the symptom, in this case dysmenorrhea, is the body's response through the mind and body's response to something. So in other words, the illness, the discomfort, the pain, the heavy flow has meaning to the subconscious mind. And so then our job, if we're going to tackle that problem, is to come and discover through, as Elman called it, hypnoanalysis, or we now call healing hypnosis by regression to cause, what's the cause?
Right.
What's the meaning of this?
Right.
How come it's the case?
And the reason that you and I both had cases where given direct suggestions, the condition got worse.
Right.
And you can remedy that, even if you don't, you can take away the suggestions and so forth. But the reason a lot of times is the fact that the what's happening, the dysmenorrhea, or I had a case of sleeping, difficulty getting to sleep. It's the subconscious trying to send a message to the conscious, hey, there's something wrong here.
Yes.
You need to take care of it. And so if you try to take it away by direct suggestion, it's going to speak louder to you.
Exactly, and this comes right onto our model of the subconscious mind as being a manifesting these signals through emotion initially, but sometimes through illness, warnings. If we view it in that way as messages and warnings, through that model, a lot of these things become explicable. And so it's not just a question of us, a lot of the old thinking, and still in some courses the thinking was that we try and bulldoze over, we beat the subconscious mind into submission and bend it to our will, which we really can't, even if we think we can. But instead, formulating an understanding of why it's manifesting this. What's it telling us?
Right.
Why does this have, what meaning does it have? Sometimes the famous hypnosis, who I don't quote that often, but Milton Erickson, would sometimes you talk about the meaning of pain. What does pain mean? And at first one would say, well, pain doesn't mean anything. It just means discomfort.
Right.
But somehow, again, it's a message. It's something coming up.
Exactly. Right. Exactly. So move to the next one. The case is amenorrhea. That's where there's the absence of periods. Right.
So periods just stop again for no organic
Completely.
reason in healthy,
Right.
and otherwise healthy women.
Right. And otherwise
Right.
healthy women. And the medical definition, because I looked up exactly what's the technical definition, is if a woman's missed 3 consecutive periods, or if a girl hasn't started her menstruation by age 15, they classify it as amenorrhea.
Okay.
And so what are the causes? Well, here's some of the organic causes. Well, if you're pregnant, your
Yes,
period stop, right?
that'll do it.
Right? Problems with reproductive organs or glands that regulate hormone levels, and it can be something serious as a pituitary tumor, thyroid malfunction, early onset menopause if the woman's older, and so forth. Some medications will cause it. We know birth control. I guess some antipsychotics and antidepressants can also do that. And then lifestyle. If you have very low weight from anorexia, let's say,
Yes.
or excessive exercise. I mean, some of
Yes.
these people who are top exercise, the women, it shuts off their monthly periods.
Yes, I worked with an athlete who confided in me that she hadn't had a period in 6 months.
Right.
And I also worked with a number of people suffering from anorexia nervosa who hadn't, some of them had stopped having periods 9 months, a year ago.
Right.
But
Right.
again, they were in specific physical conditions.
And one thing, and that it's something to really get to your doctor about, because even if there's not something really wrong, tumors and things like this, you're putting yourself into an early menopause, and it can affect your bone density and things like that.
Right.
So it's a thing to take seriously.
Right.
And stress can of course.
So therefore, it seems like you've almost dealt with everything. So what is it that dysmenorrhea, as far as hypnosis is concerned, deals with then?
Well, that's the whole thing. Is basically
amenorrhea. I'm sorry, not
amenorrhea. Yeah, I mean, you can help them with the stress, right? Through hypnosis and so forth. You can't change the pregnancy, and so forth. A lot of these, if they're serious, obviously that's the doctor, to handle. But if there's no known cause, or if it's something like it seems just like stress and this and that, it can be treated hypnotically. So I'll just back up for a second. Some things, if it's hormone imbalances, they can use hormone therapy and different things like this. But if it's none of that, you can actually use hypnosis to restart your period. And if it's caused by these lifestyle issues, that's a good target for using hypnosis and so forth.
Right.
And
so to enable you to change the lifestyle choices, so that or be amenable to changing those choices, I suppose.
You might change them, or you might be able to bring it back even despite them. I would like to investigate that and see what actually happens. So our famous doctor, our famous Dave Ellman, our hypnotist there, he was teaching all these doctors, and this one was really interesting. Is the doctors, they would come in week after week,
right?
And then at one point they would bring in one of their patients that was just volunteering to do whatever,
right?
Just go into a hypnotic state and demonstrate things and so forth.
Right.
Well, this one doctor brought a female patient in, and she, Dave had her sit in the chair where he's going to work with her, and as she's sitting down, she says, "Well, I don't know if this is going to work tonight, because I don't know if I can relax. I have this feeling around my abdomen that, I always get that right before I have my period, right? And it's a tightness, I guess, and things." So she thought she could relax. It was an offhand comment that she made, right? And Dave Ellman said, well, that'll be the first thing we'll have to fix. And by talking to her, what he found out is she hadn't had periods in about 9 months, but she had this sensation every month, I think, about this tension in her abdomen, that when she did have periods, her period would start the next day or within a day or two. Right?
Okay.
So what he said, he put her into deep hypnosis, and he gave her the suggestion that her period would start the next morning at 8 a.m. Okay, and the doctors are saying, "Oh, come on, really 8 a.m. You think that's really going to work?" He goes, "Oh yeah, it's going to work." And so then they ended the class, and the doctors come back for the next session, and the doctors are waiting for him in there, and one of them says, hey, Dave, you really missed on that one. You really missed. You said that her period would start at 8 a.m. the next morning. It didn't start till 9 a.m. And
did he allow for summertime or something like that?
Well, it was funny because his response was, well, that's good because that's the farthest away I want to be.
Right.
Because if it was much further than that, then something's not right in the suggestion or this or that.
Right.
And her period started at 9 a.m. And what he found through these doctors started using it, you could do this routinely. Now, what he did say is, if they've been without a period for months and you didn't have a signal of where the period should start,
right.
you can't just say tomorrow morning, because you have to give the body time to get ready for it, right? So if this woman had that signal, that feeling in her abdomen, so he knew he could start it there. And all he said is, if you don't have that signal, then you need to give her, a couple weeks. You say your period will start at 8 a.m. on July, 30th.
Oh, so you could still give the suggestion, but you just extend it out. You didn't have to wait for a signal to occur.
Right. Because if you think about it, what happens prior to the period? Well, the endometrium thickens. It's part of the normal process. So it probably has to do things like that.
Right.
But you could still restart it.
So this is a marvelous example of two things at the same time. One of the things we say is hypnosis can do whatever's possible, but it can't do the impossible.
Right.
What I mean by that, it sounds a bit flippant put that way, but what we mean is that it can't create the conditions in an unreasonable period of time where a natural period would happen, menstruation would occur.
Right.
Although sometimes, as we talked about in the case of certain healing, which we'll talk about a bit more, it can increase the rate at which healing takes place, which you're going to talk about a bit more. But
right.
But where it's possible, so here we've got conditions where there is a signal that the period is going to start. There is a time period in which we know it's going to occur, but somehow there's a block, and this block appears to be something that's manifesting physically. So this is an example, a really, really good example of where the subconscious mind is creating a very startling, timely, hypnotic physical effect through hypnosis, but it's because of what's possible.
Right. It's always what's possible.
Right.
And I'm going to mention a little bit about what you just said in a second here, but to close out on this now, if direct suggestion failed, then that generally meant that there's something that the subconscious is holding on to it. It's not allowing it. And
right.
so again, we go back to he would do hypnotherapy. We would do similar thing.
Hypnoanalysis, I suppose
right.
you call it.
Oh, that's what it is. Hypnoanalysis. Yeah. Thank you. We would do what we call regression to cause and so forth. And then if you got back to the cause, then you can generally fix the problem. So if you look about it now, there's the extreme cases of not having periods for 9 months, and the dysmenorrhea were extremely, extremely painful. But sometimes, even if it's not to that extent, women can be very plagued by the pain and so forth, and they can have erratic cycles and so forth. So the fact is that through hypnosis, you could regulate those cycles to make them every 28 days, make the woman more comfortable. So even if it's not an extreme case, it can be used to the good of the woman. Mm-hmm. Okay, and all that. And basically you want it to be a normal, natural cycle.
Right.
And so forth.
So this has similarities actually, as you talk about this, when we reset the sleep clock. We're resetting a part of a body's clock and a body's rhythm, where for whatever reason it's either been blocked or it's been knocked out of synchronization in some way.
Right. That's the thing, some women have excessively long periods, 8 days.
Yes.
You can shorten those too.
Right.
But again, that can be due to pituitary tumor or thyroid malfunction and things like that. So you get checked out first,
right,
and so forth. So we never want to be tinkering too much with things if things are working well. But if it's causing problems, you can move it back in, yes, to sync the way it's supposed to be naturally. So we talk about under the control of the subconscious. You've mentioned this and so forth. I was actually reading earlier today about a case, and it was a case where a woman's period stopped. Okay. The interesting part was it stopped as soon as she decided she wanted to get pregnant. So something went on there, right? So the subconscious is shutting that period down, okay? Because they couldn't find it. There's no organic cause that they could find.
So she wanted to get pregnant. So it's almost like the subconscious is creating conditions where it looks like she is pregnant, or something like that.
Or doesn't want to let her, because if you're shutting down the periods,
you
you're
can't
not
can't get pregnant,
right. So there may have been something there, and they, in some cases, you may have needed a regression to find out, is there a big cause. In that case, they just used simple direct suggestion, and they started her period, and things went on, right? But if it didn't, it's because the subconscious is stopping it for a reason.
Right.
And so, I mean, if you think about it, if there is something that stops a period, that the subconscious is stopping it, well, why couldn't it start it? I mean, right?
Really, really, really good point. And again, folks, if you're thinking of seeing a hypnosis practitioner for any reason, just bear this in mind. Most hypnosis practitioners, most of the time, are going to only be using direct suggestion. So what we're saying is even for things as physical as that, the direct suggestion may work if it's given repeatedly, but sometimes it's not going to work. Now, again, I just want everybody who's watching this to know that does not mean that hypnosis does not work or that it can't work for you. It's just the application of hypnosis in that particular instance is run into a roadblock.
Right.
And a further, deeper series of techniques is required. In fact, in some ways, the rejection of those suggestions in the absence of other organic causes or pathology is very, very significant, because as Bill said, and as these studies reveal and other hypnosis practitioners have discovered, the manifestation of the symptomology is an expression of the subconscious mind. It's trying to tell you something, it's a message.
Right.
And so we very often somebody will come to us and say, can you deal with this, and can you fix this? And sometimes we'll say, yeah, well, let's try direct suggestion at first. It's simple, it's straightforward, it's easy. Well, maybe it'll get the job done.
Right.
But if it doesn't, we reach into our hypnotic toolbox and we use another tool.
Right.
And we explain up front that it's possible that that's the case. So again, if you find yourself going to a hypnosis practitioner who only uses direct suggestion or indirect suggestion, that's just a difference of style about how the suggestions are delivered. It's not a difference in methodology, but doesn't understand how to use or will not use or cannot use any form of regression, then it's time to find a different practitioner.
Right.
So,
right. And we're very careful, about talking to the client beforehand. And folks, there's a lot of hypnotists out there that you can go to for smoking cessation, and you'll call them up and say, I want to stop smoking. They say, come on in, and they just give you suggestions. We actually interview the client very thoroughly to talk about when they started, and to find out if they're really a good candidate for a smoking cessation program, ours, because they have to really want to quit, and we test them for that.
And they have to be sick of the status quo.
Exactly.
That's the two conditions. And again, even though, as Bill quite rightly says, we interview and we ask questions, and good hypnosis practitioners will do that. Even then, we can on broad terms say, okay, you're not a good candidate.
Right.
But sometimes the only way we can find out more is by doing a session, by finding out
Right.
what's going on.
Right.
There's only so much you can do, as it were, by looking at the outside of the car. Sometimes you've got to get the hood up and get underneath there and start poking around and figure out what's going on.
Right, right. And the thing is that, of course, I think the thing that surprises people sometimes too is our program is more expensive than some of these others
sometimes,
and so forth. But when you look at what we do with it,
right,
it is the Cadillac of smoking cessation programs.
Yeah,
it encompasses so many different things.
Yeah, it's an example.
And I was recently talking to a potential client, and I told him, I said, well, yeah, I'll test to see if I think you're really ready to quit, and if not, I'll tell you not to waste your money.
Right.
There's not many would do that.
And so again, when we come back, talking about the physical hypnotic phenomena,
right?
We are looking to test. We are looking to see. It's remarkable what can be achieved with simple hypnosis and simple direct suggestion, correctly conducted and well done. And that's the other thing, is that not all like the same as any practice involving skill, there isn't equal skill amongst practitioners. Some are better than others, some are more experienced than others, some have specialties in certain areas. And so again, just for those of you who have perhaps heard of hypnosis being used in the past, or have used it yourself for something and it hasn't quite been effective, don't just reject the modality entirely. It may be that the practitioner you went to was not experienced enough or knowledgeable enough about a certain area, or maybe for some reason the timing wasn't right for you. It doesn't mean that the tool doesn't work, because your subconscious mind works.
Right.
Your subconscious mind's always working. It's just a question of how we can recruit it to help us.
Right, right. So now let's move on to healing. You know, and the things that we've seen with healing. You know, as you know, we do surgical. We help surgical patients before surgery, and you know, a lot of it can be that they're frightened to death of the surgery and so forth. So a lot of what we do is to help them be prepared so that they're, you know, lower their stress level.
Yeah,
and
emotionally, psychologically.
Exactly. But then the other thing we do, and I think it surprises people, is we give suggestions for quicker healing, better healing, and so forth, and more rapid and so forth. And so it may seem surprising that can happen, but there have been different studies conducted on this exact thing. Does it accelerate healing? And so, you know, I did some, you know, research on the web to kind of ferret out some of these studies, and let's talk about them.
Yeah.
So the first one I want to talk about it was a study on bone healing. Okay, and so it was I'm going to say it's a randomized controlled pilot study, and it's blinded. Now let me explain what that means. Randomized means that you have a patient come in and they get randomly assigned to either the hypnosis group or a control group. Okay. And the reason you do that is so that you can't say, well, we'll make the easier cases go into the hypnosis group, right? And so you just randomly assign them, right? And then it's blinded. What does that mean? Well, it means that the patient might not know in some cases what treatment they're getting, or it could be that the people evaluating it. Now, it's a little harder in this case. The subject generally is going to know they're being put in a hypnotic state and so forth, right? But what you can do, and what they did in these cases, is you have the people doing the evaluation of these patients. They don't know which group these people are in.
Right.
So you have one group of practitioners doing the hypnosis part, and the evaluation part's done by somebody else.
Got it.
Okay. So that makes for a really good study. It's a pilot study and so forth. It was done at Mass General in Boston and this McLean Hospital in Belmont, Mass. Mass General is very well known.
Right.
This is a very famous hospital, so you know the quality is really high.
Right.
Okay. And what they did is they took 12 patients, 6 went into the treatment group, which means hypnosis, and 6 went into the control group. And what that means, they all got standard, you know, orthopedic care if it's casts on them and some things like that. Then they do radiographs, and when I say radiographs, we're talking X-rays, right? And also clinical assessments, and I'll talk about that. And they followed over 12 weeks, because by week 12 you should be healed up, is what I understand from this.
Right.
What they found was that there was faster healing through week 9 for the hypnosis group. And you say, well, why wouldn't it be through week 12? Well, by week 12 everybody's healed, right? So they catch up. And what they did is they did these radiographs, these X-rays, and what they found is that there was a notable difference in the fracture edge healing. So the healing at the edge of the fracture at 6 weeks. So they could see a big difference. And what they did is they'd take these X-rays and they'd hand them to a radiologist to read, who doesn't know which one
group
of these,
it's from.
Right. Did they get hypnosis or not? He has no idea.
So that's the blind element of the evaluation.
Exactly, and so forth. And so what they found is the hypnosis group healed at week 6 it was, to the same extent that would normally take 8.5 weeks. All right, so that's huge.
Yeah, statistically that is, I mean, in terms of the rate of healing, that's an enormous difference. Now, Bill mentioned that this was a pilot study, and you mentioned to me that when you're testing drugs, you do 3 levels of study. quite simply because the final studies are so expensive because it involves so many people and so much in terms of resources. So these types of studies are done initially to say, okay, as I understand it, we've got enough here to justify doing a bigger study. If somebody would give us the money to do it. If anybody's out there that's got the money, let us know.
and that's going to be the issue in the end. You know? Yeah, that's exactly it. You start with a small pilot study, you get a signal, you say, okay, we're willing to spend more money, and because with pharmaceuticals, the sample sizes have to be extremely large, to get valid, statistically significant differences between the groups, and hundreds, thousands sometimes to do it. So it's very expensive.
Yes.
And anyway, so the other thing is about it, and this is true across a lot of things, is radiographically they showed better healing at 6 weeks, or healing at 6 weeks that would normally take 8.5. But does that mean anything to the patient? Okay, and the answer is this: is they also do these orthopedic assessments, during this time period. And what they do is they look at the ankle mobility, the functional ability to go downstairs. In this case, how much analgesics are they using?
Were these, just to clarify, were these ankle fractures or were these?
They didn't quite say, but I think they must. Well, they have to
all on the lower limb.
Yeah, they have to be right down there because if you talk ankle mobility, it has to be that. Yeah. So and then they used self-reported pain scales. Okay. And what they looked at is they said that the hypnosis group had better healing through week 9. They had better improved ankle mobility. They had a greater functional ability to descend the stairs. That is important to a patient.
Sure.
The patients used lower amounts of analgesics, painkillers, at weeks 1, 3, and 9, and they had lower self-reported pain through week 6. Because once you get to a certain point, well, the pain's going to be way down in everybody. So that's why it's only week 6 and not further probably. But there's some things, and so you see this huge trends that it's better with the hypnosis patients, and this is without us really knowing what's the quality of the hypnosis practitioner.
Yes.
And what depth of hypnosis did they bring them to?
Yes, that's true.
And we know that's really important for the effectiveness of any hypnosis.
I mean, one of the reasons that I believe, for example, that Dave Ellman's the studies and the mini studies that he did with doctors were as effective as they seem to be was because he was a very expert hypnosis practitioner, he was training serious people, and he was really making sure that they were well skilled before they went out there and practiced it. So I think in terms of subjective quality control and even objective quality control, in terms of the skill of the practitioners, it was considerable. With some of these studies, we don't exactly know what happened, which in some ways makes the results even stronger and more powerful, because what we're saying is with even an average level of hypnosis, with an average standard of skill, perhaps lower with great respect than we would hope for, there is significant physical phenomena and manifestation. And this is thanks for turning that up, Bill, that's a marvellous example of a study. And I'm happy to see that there are people out there that are still interested in these phenomena and want to keep studying them and looking at them. It would be marvellous if we could do larger studies, and it would be even better, in my opinion. I've long believed that people who undergo certain procedures, a part of the procedure should be hypnosis before, hypnosis during, hypnosis after, because everybody benefits. Healing is more rapid, easier. That also means that the expenditure on resources is overall lower. And the patient's comfort is certainly higher. So
and there's no with medications you always have side effects.
And there's no side effects.
There's no side effects with
this. Just time.
And so what they concluded, the authors, the doctors doing this, concluded that, and this is their statement, I'll read it. Data suggests that hypnosis may be capable of enhancing both anatomical and functional fracture healing, and further investigation is warranted. That, the reason they say may, because with such a small sample size, you can generally only see trends, but that's what you get with any small sample study. But the fact that they say further investigation is warranted, because if they didn't think there was something there,
they wouldn't.
They wouldn't say.
So let's just pretend, Bill, because you were from that end. Let's just pretend hypnosis was a patentable drug. I know it isn't, but let's pretend it was. If a group from your former company was looking at something like this, would be enough? I'm presuming for them just to say, okay, we need a bigger study and maybe a bigger study.
Yep.
Right. And again, the thing that, all sorts of things are said about drug companies, but they're commercial organisations. They have to make money. They have to make a profit. And they can't justify the cost of these large-scale studies unless at the end of the day there's something where they can make a profit, because they exist to make a profit for their shareholders, and that's why they're there. It's part of their dictates.
Right. And I just want to say something about that, because this is really important, because what is the holdback with larger studies here? It's just financing.
Yeah.
Because these things are expensive. I worked on one, or I knew of one medication that to get it to market cost $1 billion in studies.
Yes.
Because we had to prove things right to the nth degree.
Right.
And so you had to do such expensive studies because of the number of patients you needed.
So sometimes a question we're asked frequently is, well, if hypnosis is so effective, and if it can, why isn't everybody doing it? Why isn't all these people doing it? And Bill provides there, in essence, one reason why, which is that, to make it acceptable, provable to large sections of the medical community would often require one engaging in large-scale studies, and who's going to finance it?
Right. Who's going to pay?
And because where's the payoff at the end of the day? And so, folks, this is an issue. It doesn't mean that these things are ineffective or they're quackery or they're odd phenomena. It just means that not enough people know about them, and unfortunately, not enough large-scale, serious studies have been done using them. It's not that they're ineffective practices.
No, it's just, and some of these studies that I looked at here, it's National Institutes of Health.
Right.
Okay, but there's only a limited amount of funding they can have.
Right.
I mean, this is why medications cost so much.
Yes.
When you have to spend $1 billion, you have to make that back.
Yeah.
And we actually lost that drug right at the very end. So we spent $1 billion and got no return.
Wow.
Wow. So I mean, and the NIH doesn't have $1 billion to spend on this stuff, right? And there's no way to commercialize it at the end to make the money back.
Right.
So you're going to have to be content with smaller studies and things like that.
So out there, if there are any wealthy and public-minded individuals who wish to help us mount these studies in conjunction with institutions, let us know, contact us, because these are really important areas of work, and not just in this part of the world, but anywhere in the world where human beings exist and one person can communicate with another. These are effective, physical, measurable phenomena by test.
Right, exactly.
Through hypnosis.
So let's move to the second study I looked at here.
Right.
And this was a clinical study of 18 women having medically recommended breast reductions. Mm-hmm. Okay, this was published in Harvard Magazine in 2003. So this is, again, that's a not a quack publication, and so forth. And so what they did is they took these 18 women and they split them into 3 different groups. Yeah. The first group of 6 received 8 sessions of hypnotherapy, so 8 sessions. The second group of 6 received 8 sessions of psychotherapy to provide emotional support only. Right. And the third only received standard post-op care. Okay. All of them got standard post-op care, but the third only had that. Okay. And what they did is, and this is what we do in our surgery program, our hypnosis surgery program for our clients, is we target different aspects of the process. Mm-hmm. So they targeted specific aspects of healing at the different stages, because you go through different stages as you heal. Right. So this included decreasing inflammation, so that's right at first, right? Repairing wounds to soft tissue, okay? And then avoiding scar tissue even. So they gave suggestions across a really complex array of targets, okay, for this. And then what they did is they had nurses examine the wounds, and let's see, how long did it say how long this went on? I can't remember. I think it might have been 6 weeks. So they had these nurses assess these wounds over 7 months. Sorry.
Over 7 months.
That's what I got. Okay. Over 7 months, these nurses didn't know which group these patients
Which
were
are the
in.
three groups?
Nope,
Right.
had no idea. So the people doing the hypnosis were very separate.
So that's the blind element.
That's
again.
the blind element,
Okay.
which is important. Okay. They also had doctors study digital photographs of the wounds.
Right.
Okay. So again, they're blinded. They do not know which group these patients are in. And what they found again was healing rates for the hypnosis group were faster than the psychotherapy group. And those actually were faster than standard post-op care, receiving no real intervention other than standard care.
Right.
So, the psychotherapy
So psychotherapy
did help.
was more helpful than just post-op, right?
Than just post-op. And then the hypnosis was even, faster than the psychotherapy group.
So of the three groups, the people in the hypnosis group responded more favourably
Right.
than the other two groups.
Quicker healing.
Right.
Exactly. And they didn't go into, I think it was more of an abstract of this, or it was an article, right? And they didn't go into, I would have loved to hear more about the scar tissue formation
Right.
and things like that, but they didn't talk about it in this article. And what they found is, okay, the doctors just looking at the photographs, they showed trends towards, the readings they took showed trends towards faster healing in the hypnotherapy group versus the other groups, but it wasn't to a statistically significant level. Okay, but it's good. It's trends. That's good. And in small studies, it's hard to get that.
Right.
It's statistically significant again. The nurses' results, and remember, they're blinded, so they don't know what group the patients are in. They found that statistically, the differences were so large that they could have occurred by chance in less than 1 in 1,000 cases.
Wow.
That's huge.
That's massive statistically.
Yeah,
Right.
So even with such a tiny group, it's randomly, maybe once in 1,000 you get these results.
Right.
But it really points to the fact that.
So again, working on from a scientific basis on a hypothesis, the hypothesis has to be that the effect is not random, but is produced by what's being done.
Right. Exactly.
Right.
Exactly. So again, those are just two quick studies that I looked at, and there's actually a lot more out there though. As I was doing the research into this to see, there's actually a lot out there. It's a shame that you don't see more of this.
Well, I think, as we talked about, there's a commercial element to it.
Right.
Quite simply, it's relatively straightforward to mount fairly small studies, small groups of people,
Right.
small numbers of practitioners. The difficulty is expanding that to larger studies, unfortunately.
Right.
But this has been very, very helpful, Bill. Thank you for doing that research. And I want to also, if they ever get to hear us, thank the people who engaged in this work, conducted these studies, were intelligent enough and serious-minded enough to engage in this, because as these things become more commonly available, people, individuals and large groups of individuals across the whole world can benefit. Again, it's back to the same thing. That's part of the reason why we do this show. We want people to know. We want people to understand that these phenomena that are not always easily explicable, but are real,
Right.
are measurable, are helpful. It's not quackery, it's not voodoo, it's not merely stage entertainment, it's not magic tricks, it's not, weird forces, it's science. We can't always explain exactly what happens, but we can observe the effects and we can measure them. And you and people, your relatives and friends, can benefit from them if you can find people who practice these techniques, and they're out there. So, that's the whole purpose of what we do here, right, Bill?
Right. Yeah, this is the whole thing. Is that there's a lot of variables in in any of these things. Is the hypnotist, the hypnosis practitioner, are they really excellent?
Yeah, they're skilled.
Are they skilled?
Yeah.
Are they trained in that specific area? Because you need to know what suggestions to give if you're using direct suggestions.
Yes.
Also, if there's some deep cause that is causing these physical problems,
Right.
direct suggestion may not work.
And we know, or we can, well, we don't know, but we can make a pretty good hypothesis that a percentage of these people, there's some cause, just statistically, because that's what we come across when we meet with and treat people.
Right.
there's some group of people for whom there is a deeper emotional cause and are not going to respond to that direct suggestion. So to me, that indicates that hypnosis may in effect be even more effective than these measurements indicate. Just in the same way as when Ellman took that study and found that 8 out of 10 got pregnant, but with the 2 that didn't, hypnoanalysis, regression to cause, can be effective.
Right.
Again, extraordinary.
That's it. And and again, you would have said, if you only talked to those 2 women, the couples, they would say, oh, it didn't work.
Right.
Right. Well, when he delves into it further, he finds out the causes.
Right.
And it remedies it.
Right.
You know, and so forth. And so, yeah, you can't just dismiss it because of, you know, of one experience with one hypnotist.
Yeah.
That's the whole thing about some of these very cheap group smoking cessations. You go to a hotel and there's 30 people in the room.
Right.
Well, their rate's only 10% or 20%.
Yeah.
Because they're not using...
not 20, more like 10, 9 or 12.
Yeah, there you go. And they're not using the best techniques, and it's not targeted for your individual.
Right.
Whereas, you know, ours is almost a guarantee. If you're truly ready by a certain criteria to smoke, and you commit yourself to it, you're going to quit smoking.
Yeah, and that's just an example of something where we've looked at it, we've measured it, we found it. So what Bill was highlighting here, it's very important, is hypnosis is not all the same. There are differences in programs, there are differences in levels of skill, there are differences in what's going to happen and what's going to occur, and it goes the full gamut. There are some very skilled practitioners, there are some moderately skilled practitioners, there are some people, in my opinion, who shouldn't even be called practitioners, just terrible at what they do. And it's not easy to identify for people out there which is which, and this is why we do these shows, to help you find somebody that can help you in whatever it is you're seeking help for.
Right. So, and the thing about some of these things, the interesting thing is sometimes people just don't think of it because they think, well, I'll do it on my own. I was talking to a client recently about smoking, and he said, well, I've had lots of friends quit, and they just did it on their own. And as a former 2-pack-a-day smoker, I said to him, yeah, I understand that, but when I did it, it was one of the toughest things I did in my whole life.
Right.
And our clients go through easily, not with struggle.
Right.
You know, I gained all this weight.
And so this is another important point, folks. Sometimes, yes, you can do things without hypnosis, of course you can, but you can make your life a whole lot easier by using these techniques.
Exactly, that's the whole thing, yeah.
And once again, the one hypnosis factor that we don't seem to be able to control is time, and we've got beaten again by time. So thank you very much for watching this edition of Hypnosis Help. I really want to thank Bill for delving into those studies and presenting them to us. I hope they're useful to you. And until the next edition of Hypnosis Helps, this is Neil Myers, hypnosis practitioner, and Bill Miller, hypnosis practitioner, saying happiness, health, and see you on the next time.